Hello. Hi, everyone. Welcome, welcome. Welcome to Q&A with Dr. Mercy. Hello. Happy Friday. Welcome, welcome, welcome. I hope your weekend was well and everything that you wanted to happen in a positive way actually happened for you. So, welcome to another session of Q&A with Dr. Mercy live. I am Dr. Mercy, and we're going to have a very interesting topic today. It's interesting, but yet it's very common topic as you do see. It's going to be about high blood pressure. But before we get into that, I always like to ask, where are we viewing this live from? So where do you all live? What city? What state? What country? Always like to see where everyone resides. So welcome, welcome, welcome. If you can, just jot down in the comment section where you're viewing this broadcast from. That would be great. Can everybody hear me? Can everybody see me? I don't see comments just yet. Let me go back. Let's see. Hi, hi, hi. Oh, hi, Benita. Oh, Fairhope, Alabama. Hi, how are you? Thank you for watching. Anyone else? Ooh, let me. So, welcome, welcome, welcome. Looks like there were some connection issues. Just one moment here. Let me continue to connect, make sure everybody can see us. Want to make sure our LinkedIn family can see us. So, hi everyone. We'll be starting in a moment. Just a moment. Let me make sure. Oh, okay. Wisconsin, Kim Little. Thanks. Welcome. Let's reconnect. Let me make sure. Is everybody okay? Make sure I'm reconnected. All right. Okay, looks like we're having some connection issues, but that's okay. We'll just keep on going, and we may just have to rebroadcast it in some of our different stations. So welcome everyone. Thank you guys for joining in. I wanted to do this live topic on the silent killer. But before I do, let me just introduce myself. My name is Dr. Marcia Johnway. I am a internal medicine physician. So I'm actually a physician that takes care of older patients. So not really pediatrics, but more so 18 and above. And I typically work in the hospital. I work in a hospital in Texas, and I'm actually a nocturnist. And people may ask, what is a nocturnist? Well, a nocturnist is a night doctor. So I work primarily at night. And the reason why I wanted to kind of give you guys more information when it comes to that is because time and time again, I'm the one at night. If you're in this rural city where I work, in this small hospital, if there's a time where the emergency doctor needs to admit someone to the hospital, meaning they've assessed the person in the emergency room and they're wanting to now move them to the hospital for further care, they call me. And a lot of times when they call me, recently for some reason there's been a lot of there's recently for some reason there has been a recent rise in people with uncontrolled high blood pressure, and a lot of them happen to be minorities. So I thought during one of my shift work, I said, you know what, I think this is time to just talk about high blood pressure, and kind of gauge what people do and do not know about high blood pressure. I mean, it's a very common disease. It's something that a lot of people have, but do they really understand it to the degree that they need to? So I decided to take this live to just kind of talk about it. If you guys have any questions, feel free to jot them down um, on the comment section. For some reason, there may be some technical delays, or it seems like there's some obstruction in some of the channels. But the ones that I do see, I will be able to answer them. Okay. So let's just jump right in. If I was going to make this interactive, we'll see based on our technical difficulties if that's possible. If not, that's cool too. So hypertension, also known as high blood pressure, also known as the silent killer. Why? Because a lot of diseases come as a result of high blood pressure. Once you get high blood pressure, if you don't take care of it, it can cause other diseases. And it's silent because people have had long standing high blood pressure and they may not even know it. I remember doing a mission trip in Africa and we were doing routine blood pressure checks. I was amazed to see people who had no complaints whatsoever. When we checked their blood pressure, they were in the 200s. So that is something to, keep in mind that, that is something to keep in mind that they were in the 200s, which is essentially like stroke level. But for them, they may have some symptoms, but they did not know that all this time that high blood pressure is working really, really against them in their body. So let's just jump right in. Okay. So I'm just going to go down to the basics. So down to the bar, like the bones of high blood pressure. So there may be some things that I may say that that's great, but some people may not. I just want us at the end of this talk to be able to know everything there is to be about high blood pressure. And again, the reason why I'm saying this is because when I went to the hospital, or when I've been to the hospital working for the past couple of months, I've realized that there's been a certain rise in uncontrolled high blood pressure. So I wanted to make sure that our community knows exactly what they can do for their body and optimize it so I don't have to see them in the hospital with a blood pressures of 200. So let's just go to the basics. What is systolic and diastolic blood pressure? So you do know that for blood pressure, there's two readings, okay? There's one that's on the top and there's one at the bottom. So people know, and yes, Anita, I'm about that next slide, Anita, is going to answer that question. So thank you for that. So people know, see two numbers and they're just like, I guess that's the typical, when you talk about blood pressure, you should say something about the top number and say something about the bottom number. But do you actually know what these numbers mean? Well, the top number, it stands for the pressure that happens when your heart beats. So, when your heart is beating like boom, 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 boom. That pressure, if you were to get a pressure reading inside the arteries, every single time the heart is pumping blood out into either into itself or into the rest of the body, you take a pressure reading, that top number is the pressure when the heart is beating. Now, when the heart is relaxed, so in between those beats, that is the bottom number called the diastolic pressure. So if you remember, the top number is when the heart is beating, boom, 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 boom. And the bottom number is in between those beats when the heart is relaxed. And you take the pressure. So the top number should always be higher than the bottom number. There are some cases where you have bottom number higher than the top number, and that is usually because there's an artery problem. The arteries are are either hardened or they're in a lot of pressure. So typically it's the top number have a higher reading than the bottom. Okay. So we're going to go to the next. And okay, we'll come to this right away. I'm sorry, I'm going opposite. We'll come to this. So to answer your question, Anita, what defines high blood pressure? What is a normal number for high blood pressure? Thank you for asking that question, because normal should be just kind of what we actually saw in that previous slide. Normal should be 120 over 80. That's normal, okay? Anything less than that is optimal, meaning that that's where we want to be. We actually want to be 120 over 80 or less, but we don't want to be too low, If you are looking at blood pressures in the 100 or less of the top number and 60 or less in the bottom number, that's way too low, Okay. And there's many reasons for that. One of the number one reasons for having low blood pressure is dehydration or loss of fluid from your body. Loss of fluid from your body could be due to dehydration. It could be due to blood loss. So if you're seeing low numbers, and like what I said is, it would be this top number here being less than 100 and this top bottom number here being less than 60, then it's something to be of worry about, okay? Um, some people, though, you welcome, Anita. Thank you so much for asking that question. Some people, though, tend to have low blood pressure despite despite it being not normal. And these people are usually underlying heart conditions that causes their blood pressure to be low or other conditions. So, but the typical person should typically have their blood pressure, if it's 110 to 120s on the top number, or if it's 110 to I'm doing it here. If it's 110 to 120s on the top number, or it's 70s to 80s at the bottom number, that's the ideal, okay? Okay, Benita, I saw your question and I will answer it. Thank you for that, and keep on asking more questions. And let me actually answer that just in case I forget. Benita asked, I lost over 120 pounds. Wow. I didn't take my blood pressure pills every day because my blood pressure is now 115 over 66. I'm 69 years old. Should I continue to take blood pills every day? No. So this is a perfect example of how weight loss can help cure you from high blood pressure. I talked about it. I think the last time I was on, I talked about, having optimal eating, exercise, and how you're able to be cured from certain conditions such as high blood pressure, such as diabetes. And this is one example. So your blood pressure, just like we just talked about, is in the range of between the 110 to 120 top number, and in between, it's actually a little bit low, but it's typically should be 70 to 80. So should you continue to take your blood pressure pills? This I don't know if this 115 over 66 was on your blood pressure pills, but first of all, I would say confirm with your doctor what you need to do, because your doctor knows everything about you. And if you have certain underlying conditions where the blood pressure medication should be used, they would tell you. But your blood pressure right now seems to be optimal, and if I was your doctor, I would hold off on your blood pressure medications at this point, because as far as I'm seeing, your blood pressure appears to be on the optimal side, if not a little bit low, but I would hold off. Definitely, please make an appointment to see your doctor to confirm. But if I was your doctor, I would tell you to hold off on your blood pressure medications at this point and continue checking your blood pressure at home to make sure that it's still optimal, okay? Anita, you asked another question. When working out, should your heart rate be? So that's a good question. And obviously it should be at a high rate. It should be at least above 25% of your baseline heart rate, really. But each person is different. So we can talk about that when it comes to exercise and heart rates, because each person is different and they respond to exercise differently. Okay. So getting back, no problem, Benita. Thank you so much. Getting back to this, now that we know the systolic and diastolic blood pressures, now we can say what defines a high blood pressure. So, and normal is anything less than 120 on the top number. And then on the bottom number, it's anything less than 80, kind of like what we said. Now, it kind of gives you a, if you are 120 to 129 on the top number and less than 80 on the bottom number, you're under this yellow category. And I think they kind of did this graph like how you would if you are in a stoplight. Yellow meaning we need to slow down on what we're doing. In this category, you're borderline. You're not high blood pressure yet, but you should start looking at your risk factors. Are you exercising as often as you should? Are you eating too much salt? Are you or processed food or fattening food? Are you a little bit overweight? And you see, as Benita has showed us, losing weight does affect your blood pressure in a good way. So here it's elevated, but not enough where you need blood pressure medications. I would just be checking it, once in a while and see if it gets higher than that. So stage 1 blood pressure, this is according to the American Heart Association, is when you're 130 to 139 and the top number, and then the bottom number is when you're 80 to 89 in the bottom number. Again, with stage 1 blood pressure, it's not something where I, as a doctor, would immediately put you on medications, but I'd be telling you, your blood pressure is creeping up a little bit. Let's start looking at our risk factors. Let's start halting some of this progression to bona fide heart hypertension. Okay, so what are we doing that we can stop that can bring this back down? That's what that would be the discussion that I'd be doing with you at this stage. Then we have stage 2, high blood pressure. And so at this point, you kind of are already in the high blood pressure, hypertension stage. And that's when your top number is 140 or higher, or your bottom number is 90 or higher. Again, at this stage, what we typically do the first time around, we say, okay, your blood pressure is high. We're going to repeat it in the next time you come in. So we may have you come in a little bit sooner than normal, at like 2 weeks or a week or even a month or so, to recheck it. And if it's still high, we may put you on something. In addition, we will also ask you to take your blood pressures at home, because there is a such thing called white coat hypertension. And white coat hypertension is when you go to the clinic and you're feeling anxious, or because of that walk from the parking lot to the clinic, inside the clinic, your heart rate and your blood pressure came up just from the fact that you were walking. So we do understand the fact that the blood pressures that we take in the clinic may not accurately reflect your blood pressures that you have every day as you go around during your day. So that's why we also recommend you have a blood pressure log that you take. And I will show you in this video from the American Heart Association how to properly take your blood pressure. So we'll talk about that as well. And then definitely anything higher than 180, which is what they say here, and anything top number, and anything higher than 120 bottom number, this is what we call hypertensive crisis. It's okay for some people, it's go to the emergency room. We need to bring it down because we're not wanting to get a stroke or a heart attack here. And we need to give you medications. And so if you are ever at that high level, don't be surprised if your doctor gives you 2 blood pressure medications instead of 1, because typically in that stage you need 2 to be able to control it. Okay. So I'm going to go back to the video, which should show you how to properly do a blood pressure, how to properly put your blood pressure machine and cuff on. And it's about 2 minutes. So, and it's by the American Heart Association. So let's tune in.
Okay, let's have a real talk about blood pressure. Do you monitor yours regularly? It's something everyone with high blood pressure should do, but it's something most people don't know how to do correctly. Checking your blood pressure regularly will help let you know if you have it under control. It will also help you start to understand which factors are putting you at high risk for stroke and heart attack. Before I get to that, though, I just want to stress one thing. If you have high blood pressure, you should talk to your doctor to figure out how frequently you should be checking it at home. For most people, taking your blood pressure twice in the morning and twice in the evening, even just for a week, will help you and your doctor get a better understanding of your blood pressure. For morning readings, it's best to take those before you take your blood pressure medication. It's also very important to avoid exercise, caffeine, or tobacco at least 30 minutes prior to testing, since those can affect your levels. Now, let's move on to talk about the proper way to measure your blood pressure at home. Nearly half adults in the US have high blood pressure and are at high risk for stroke and heart attack. So self-measuring is one of the easiest ways to be proactive about our health. Here I have my blood pressure monitoring device. It's easy to use and it helps me get an accurate reading. Be sure to get an automated device with the upper arm cuff. That's the type doctors recommend. The first thing you want to do is find a quiet place to sit where your back is in an upright, stable position. A dining room chair is great. You want to make sure the chair isn't too soft so your body is fully supported. Sit with your feet flat on the floor and don't cross your legs or ankles. If you need to use the bathroom, make sure you go before you do your reading. Next, rest your arm on a flat surface with your palm facing up. Place the blood pressure cuff on your bare upper arm just above your elbow. Your arm should be relaxed and resting so the cuff is at the same height as your heart. Now rest quietly for 5 minutes before taking the first measurement. Avoid talking while taking your blood pressure measurement. Once your first measurement is completed, write down the blood pressure numbers and pulse that are displayed on the device. Wait 1 minute and then repeat this process again. As you just saw, it's important to check your two measurements at around the same time each morning and evening. At your next doctor's visit, be sure to share your blood pressure numbers so you can discuss the numbers and so your care plan can be changed if necessary. That's it. Not bad, right? Measuring your blood pressure at home is easy to do and a great way to stay on top of your health. If you have more questions about managing or measuring your blood pressure overall, visit the website.
So, okay. So let's see. Did I get out? Okay, let me see if I can get out. Just one moment, you guys. I am going to get out of here. So, okay. I'm going to stop sharing for a moment. Okay. And while I stop sharing, I'm going to kind of refresh and go back to sharing in a moment. So you see how you properly want to put your blood pressure cuffs on. The important thing is to be calm while you do it. Rest your arm. Make sure you're not crossing your legs, and also to make sure you have the proper cuff. If you have a cuff that's too small, it will inaccurately measure your blood pressure. If it's too big, it will also inaccurately measure your blood pressure. A lot of these blood pressure machines, they come with the standard cuff, and they come with a way you can measure that the width of the cuff is appropriate for your arm. So just make sure that that is appropriate. And always do two readings. As she said, do two readings 1 minute apart, just to ensure that there's an accurate reading. And usually some people take the average of the two to see what their actual true reading is. And as she said, do one in the morning and do one in the evening. And this is especially good for those who are on blood pressure medications, because what I have observed in the hospital is that as the hotter seasons occur, people are coming in with very, very low blood pressure. Why? Because they're outside, they're maybe sweating a lot more because they're under the sun, and they're dehydrated. So what I always like to tell my patients is, imagine having a jar, okay? And you have two jars, actually. One jar that's full of water and one jar that's only halfway full of water. And you put the same, you put one package of Kool-Aid in one and one package of Kool-Aid in the other. Which one's going to be more red? Well, the one that has the half of water is going to be more red. Why? Because it's more concentrated. That's the same thing that's happening in your body. If you are not having enough water in your system, and that tends to happen when you're dehydrated, or when you're during the summer months, you're perspiring, you're sweating, and so your water tank is low. Well, if you're still taking the same concentration of blood pressure medications, it's going to have a higher effect. And so we tend to see patients with blood pressures that are very low, especially in the summer months. And I remember when I was in training and I was being trained by the heart doctors in Arizona. Of course, you know, Arizona has a lot of desert and the heat is intense. Those heart doctors would actually tell their patients that during the summer months, just half your dose, because the effects from the sun and the dehydration was so severe that people were coming in a lot of times with very, very low blood pressure. Now, I don't recommend that for everybody. I just recommend to constantly, you know, on occasion or, you know, frequently check your blood pressure medications. Just frequently check your blood pressure to ensure that you're not dealing with low blood pressure, just like you're not dealing with high blood pressure as well. Okay, let me see if I can go back to sharing my screen and we can continue with the, yes. Okay. Okay. So, just one moment. Okay. So, okay, so what are the signs and symptoms of hypertension or high blood pressure? I was going to make this interactive, but I'll just go through it. The symptoms of high blood pressure will be what? Dizziness. You can feel your heart racing, okay? Irregular heartbeat. You can feel your heart racing or skipping beats. People tend to have nausea, vomiting. They can faint. Sometimes you do experience low blood pressure. Like I said, if you're on a lot of blood pressure medications or you're dehydrated and still taking the same amount of blood pressure medication, then you can feel tired. But the number one cause or number one symptom that I see in the hospital all the time is what this lady is showing here, and that is headache. If you are noticing chronic headaches and these headaches are just so unbearable, check your blood pressure to see if that's one of the reasons that could be causing it. Because a lot of times, a lot of the number one complaint that I get in the hospital when these people come in with very, very high blood pressure is for the past month or so, they've been having this headache, almost like a migraine. If you start noticing that, check your blood pressure. And nowadays they have free blood pressure machines in CVS or some of these drugstores or some of these grocery stores where you can just quickly check it real quick. Okay. So what are the effects of hypertension? So why do we care about keeping your blood pressure under control? Well, the reason why we care, and this is also courtesy of the American Heart Association, is because long-standing uncontrolled high blood pressure does affect the body. And it affects the body in very devastating ways. So if we go to the brain, it causes stroke. If we go to the eyes, it causes eventually vision loss if you have uncontrolled high blood pressure. If you go to the heart, it causes heart failure. It can cause heart failure or heart attacks. If you go to the kidneys, it can cause kidney failure, kidney disease. The uncontrolled high blood pressure is one of the leading causes of people having to be on dialysis. Uncontrolled high blood pressure. Had they controlled it and kept it controlled, they would not be having to have dialysis. That's one of the number one causes. And then also, from a sexual function aspect, it can cause sexual dysfunction. It can cause impotence. It can cause, erectile dysfunction, just because you're not controlling your high blood pressure. So it's very important to do so. So what are ways to prevent and treat high blood pressure naturally? Obviously, if your doctor's telling you to be on blood pressure medication, go ahead and just take it. And once the subscription is finished, go and get a refill. There's been some people that come to the hospital, or I've seen in clinic, once the bottle's finished, they're like, oh, I thought that was it. No, this is something that you take for a long period of time until either A, you notice that your blood pressure is getting very low, and that could be because you're losing weight or eating right, and actually your blood pressure is improving, and then your doctor can help you to kind of go down on the amount of blood pressure medications you're on. So, but you're always going to have to be on the blood pressure medications to keep your blood pressure controlled. Just because your blood pressure is controlled like 120s over 80s with your blood pressure medication doesn't mean that you have to stop it. You have to work with your doctor to see how you can now slowly start to get off of it. And like I said, diet and exercise, key. Okay. I just checked my blood pressure 3 times, different readings, 142 over 83, and then 135 over 81, then 139 over 73. Okay, so what you're seeing, I mean, if you remember, and I can go back to that, I'll go back, I don't mind. Go back to that slide. What you are showing us is that your blood pressure falls along the lines of stage 1 to stage 2 high blood pressure. And so these readings, that's what it's telling us right now. Okay. So that's definitely, something to look into in terms of, okay, so, if I was your doctor, again, like I said, if I was your doctor, I would say, okay, they're on the lines of your blood pressure is currently in the category of needing treatment. But if I was your doctor and I saw you for the first time, I would make sure you're not having any signs and symptoms that can be attributed to elevated blood pressure. And then I will then say, okay, how about we start looking at your diet? And how about we start looking at losing weight? And with the combination of those two, I would be very optimistic that we can be able to bring down your blood pressure back to a normal range and start getting it down. So you're in the level now, just based on what you're showing me, you're in a level where it still can be treated with diet and exercise, provided that you don't have any signs and symptoms of the effects of high blood pressure. Keep in mind also, even as people who have normal blood pressures, things such as, if you just were running and stuff, and you check your blood pressure, that can affect it. If you're highly stressed because something's going on, or you're in pain, normal people can have blood pressures at the level that you showed. So there's a lot of contributing factors in that, but if you were chill and you're calm, I would say, you're at the range where diet and exercise, losing weight, could just be the cure to you not needing medications. But I would definitely make sure that you see your doctor for follow-up and monitoring of that. So going back to where I was. So what are ways to prevent and treat hypertension naturally? So we are kind of already started talking about that. Obviously, if you have high blood pressure and your doctor says you have high blood pressure and you need to be on medications, you need to be on medications. But while you're on the medications, or even if you're not on the medications or you have borderline high blood pressure, these are some of the things you can do to prevent and even treat hypertension naturally. 1, you maintain a healthy weight. So you aim for a body mass index less than 25 to less than 25. So the body mass index, if you don't know what that is, it's a BMI, and you can see it. You can have calculators, and I'm actually going to, let me see if I can share a calculator. There's calculators online where you can calculate your BMI. And I'm going to actually Google so I can show you an example. Stop sharing, and then let me share again using, just one moment. Share my screen. So I just did a simple Google search. And you see calculate your body mass index, the National Institute of Health, which is a government website, very legit, and it's definitely something, a website I would go to. You can click there, and you see that they have a calculator. So all you have to do is you just have to enter in your height and your weight, and then this calculator will now calculate your BMI. Okay. And I know you guys probably can't see this because it seems like it's very small, but anything less than 18.5 as far as BMI, you're underweight. A normal range should be 18.5 to 24.9. If you're overweight, that's 20 BMI greater than 25. And if you're obese, it's a BMI greater than 30. Okay, Anita. Okay, so I'm just giving, I don't, Anita, I won't put that up because it's your personal stuff, but I'm just giving you examples of, how to do it naturally. Okay, so diet and exercise is always a way, no matter, we always can optimize our diet. We always can up our exercise, just anybody. And so that could be a way to help to, reduce the amount of blood pressure medications that we need. Each person is different. Also, with high blood pressure, there are people who are skinny, who definitely don't need, who definitely did not get blood pressure issues due to them being obese. It was more so because of their genetics. So we also have to put into play that genetics does also hold, something when it comes to being diagnosed with high blood pressures. But I don't know you, Anita, so it's hard for me to say personally what you need or what you don't need. But yes, I'm just saying in general, any blood pressure readings in the 135s to 140s top number and 70s to 80s bottom number is in the stage 1 high blood pressure, and you do start thinking about risk factors no matter who the person is. But thank you for your information. So getting back to what we were saying, I'm going to stop sharing again and get back to and hi, Cynthia Vasquez, how are you? Thank you. Yes, thank you. Thank you so much, Cynthia. Yes, it is. I mean, it's amazing what, a lot of times, especially in the medical field, we're so quick to give medications, but a lot of times, lifestyle modification is just as important. So I'm going to take this off. I don't know why this is here. Get off of that. Okay. So the last part of what I was going to say is ways to prevent and treat hypertension naturally. So 1, maintain a healthy weight. We talked about your BMI, calculating that. 2, what you want to do is you want to adopt a dietary approach to stop hypertension. And that's usually you want to adopt a diet that helps to lower the amount of agents in your food that can cause high blood pressure. So the DASH diet, I know that's probably, you guys have probably heard of that. The DASH diet is a diet that's been designed to kind of help in treating high blood pressure. And DASH stands for Dietary Approach to Stop Hypertension. This type of a diet consists of just eating more fruits and vegetables, whole grains, lean meats, low fat, dairy products, and also to reduce your sodium intake. And it also talks about limiting processed foods and high sodium foods, so such like canned foods or those hidden high sodium foods like bologna or something like that. So yes, that's one way to help prevent and even treat hypertension naturally. Increasing your potassium intake, consuming potassium-rich foods can help lower your blood pressure. So foods like banana, oranges, spinach, tomatoes, avocado, sweet potatoes, all of those are examples of foods that can be enriched to help with lowering your blood pressure. Again, they're also pretty much part of the DASH diet. There are uh, fruits and vegetables rather than processed foods and high sodium foods. You want to also reduce your alcohol intake because excessive alcohol intake can lead to a rise of blood pressure. So, the American Heart Association recommends actually 1 drink per day for women and 2 drinks per day for men. And we've talked about alcohol before in previous talks when it comes to how excessive is excessive with alcohol. And then I have 4 more things. You want to just have regular physical activity. We've talked about that before. That is 150 minutes weekly. So that if you were to divide that by 5, that's 30 minutes a day for 5 days in a week. Or if you want to do vigorous activity, you only have to do 75 minutes weekly. So not too bad. And that also helps to prevent and also treat your hypertension. Lastly, quit smoking. Smoking is associated with increased high blood pressure. Managing stress, we talked about that just earlier. Stress can elevate your high blood pressure. So stress management, such as yoga, meditation, prayer, breathing exercises, just hobbies can help with that. And okay, I'm sorry. What did I do? I accidentally put the numbers wrong. So these are the ways that can help actually prevent and treat hypertension naturally. So anyways, that was it when it comes to high blood pressure. I hope you guys actually gained something from it. And each person is different, even if you're on blood pressure medications and you're optimal, you are vegan and you exercise and you still are on blood pressure, that's okay. That's just your body. That could be genetics. Each person is different. So, but the whole goal is the whole point of this conversation is realize that high blood pressure is not something to play with, because if it stays in your system, it can cause very disastrous things to your body. 2, leaning to natural ways of just taking care of yourself, exercising, diet, eating well. These things can help to reduce high blood pressure. And 3, if you have it, that's fine, but making sure you check your blood pressure and check it correctly at home to ensure that your blood pressure stays optimal and it's not too low and not too high. Well, that is it for this week on a Q&A with Dr. Mercy. Thank you guys so much for tuning in. If you have any questions when it comes to this, or you even wanted to ask about other topics, feel free to do so in the comment section. And until next time, bye.